Of District 1199, the New England HealthCare Employees Union, on behalf of our 25,000 healthcare workers and our 65 nursing homes that we represent. We are bringing people together here today to talk about issues of concern at nursing homes. Nursing home workers are women and men who have huge hearts. They give tremendous love to their patients and their residents. And our almost 6,000 nursing home caregivers throughout our union have fought their way out of poverty through tremendous struggle over the years. We're here today as union members and union officers together with Genesis Management because we're working on an issue that is very important. And that's to secure the jobs of almost 2,000 Genesis caregivers and folks who provide nursing home services to about 1,400 residents in nursing homes. It's really unique for us as a union to join together with employers, but again, this is an issue of public policy that potentially is going to hurt thousands of caregivers, putting them out of work, and to hurt our economy by negatively impacting care for the elderly. There is new state policy, brand new state policy, that mandates that nursing homes that are under 70% occupancy could potentially lose their funding as of July 1st of this year, in just a few days, with no opportunity to improve their resident census, their occupancy level, or to reduce their bed capacity according to these new state regulations. This is taking place at exactly the moment when Connecticut's baby boomer population is about to grow tremendously, and as our state is aging rapidly. These closures would not only affect workers, but also the residents who receive care in Connecticut's nursing homes, especially in Connecticut cities. When nursing homes in and around cities close, it's going to make it difficult for residents to see their family, their friends, and to be connected to their communities. Nursing homes with high Medicaid populations are going to especially be affected. Our cities are where there are concentrations of poverty. Those are Medicaid residents. And so especially around our cities, those are the homes that are most likely to face closures. This is going to disproportionately impact the populations of cities, which are primarily black and brown folks in Connecticut. Some of these facilities offer special services that are not available elsewhere, including hospice, dialysis treatment, and other specialty services. As a union of 5,800 nursing home workers, including 14 Genesis nursing homes, we're here today with Genesis Management to urge the Department of Social Services, and especially our new Commissioner, Deidre Gifford, to grant nursing homes the certificate of needs that they will need to de-license nursing home beds. It's a critical issue. We want to make sure that as our state is struggling to recover from the recession of 2008, that we are not putting people out of work, that we are not driving up unemployment, and that we are not rationing care to our most vulnerable elderly citizens. Thank you. We have a couple of speakers lined up. Tony Teal from St. Joseph's Manor, who is a certified nurse today. Tony, come on up. Excuse me, I'm going to go on this side.
Hi, my name is Antoinette Teal, and this is Zena and Martha Sanchez. I've been working at St. Joseph for 29 years, and we have a beautiful place at our job. We give great care. We have a beautiful area. There's nothing I can't say that's how good we want to stay here and take care of our residents.
The unique thing about us is that we take in a lot of patients that a lot of surrounding nursing homes really don't like to take in. And we take them in with open arms, and we care for them, greatly, and make sure that we give the best care that we can to them, no matter the circumstances. It will be heartbreaking, if anything, for our facility to close down because we're one of the bigger ones in the state, and in that area we get in all types again, so we can't afford for that to happen. Not just our jobs, but where would these people hide? They don't have anywhere else to go. Thank you.
I think that St. Joseph's Manor is really a case in point in terms of how public policy that closes down nursing homes really impacts our cities. There are at this point only 2 nursing homes left in the city of Bridgeport. There's about 400 nursing home beds for the largest city in the state of Connecticut. So St. Joseph's Manor, just over the Bridgeport City line in Trumbull, is a critical place for Bridgeport residents. Again, black and brown folks in particular, folks who have no place else to go in terms of getting care, and families who rely heavily on that facility to give care to their loved ones. That facility absorbs the population from the nursing homes in the city of Bridgeport that has closed, and closing that nursing home would devastate the ability for the elderly to be able to get the long-term care that they need. Other speaker? Bertha, come on up.
My name is Bertha Mote, and I am the nurse at Arden House. I've been working there since 2006, and we just opened a new hospice unit in the end of February of this year, and it is a special unit. It takes care of the residents at their end of life, and we have 17 beds. We work together with hospice companies, Vitas, Compassus, and Seasons Hospice. And we provide special care for the resident in terms of their comfort and dignity, and especially extra tender, loving care. And we also give support to the family in this difficult situation. And so far, we receive tremendous positive feedbacks from the family. And we just have to keep that Arden House open for that reason. Thank you.
Again, in terms of the hospice care unit at Arden House, I'm somebody who personally has had two parents go through the hospice process in the past several years, and having a facility that can allow people to transition from long-term care into the hospice unit, critically important. There are times and points in people's lives, especially in their end-of-life period, where they really need facility care. They need 24-hour, round-the-clock nursing supports that cannot be provided in a home care setting. So Arden House is a facility that has staff that is dedicated to provide those specialty services, to provide it with compassion, to provide it in a way that gives people's loved ones and the families the dignity that they deserve. We also have a speaker, Kate Bartolomeo from Genesis Management. Where's Kate? Kate, please come up.
Hi, my name is Kate Bartomo. I am the Director of Social Services and the Secured Memory Unit at Kimberly Hall North. I just wanted to say that these Medicaid cuts could be devastating for our centers. We have many specialty programs, including hospice care, the dementia units, dialysis centers, vent units, cardiac and pulmonary programs. So having these cuts could severely impact the programs that we need to keep these programs running that so many of our residents do benefit from. So I'd just like to thank you guys for coming and the Commissioner for giving us this moment.
And so lastly, again, we are urging the Commissioner, our brand new Commissioner in Connecticut, to take the voices of these caregivers into account as the long-term care system is being redesigned, and allow these nursing homes and others around the state to de-license the beds that they need to be able to make sure that these facilities continue to stay open and to provide the vital services that the residents there need. Thank you. One more speaker? Who's that? No, we're going to leave it there. We have speakers that we already talked to. Okay. All right. Thank you very much, folks. For our members, let's stick around for just a minute. I know that the press is going to be wrapping up. Let's stick around for just a minute. We have a couple things we got to talk about. Okay.